Okay, and then get back over here. Zoom, and it is 2:31, so I am going to mute myself and then click go live. And you can start. Oh, wait, let me highlight you, Beverly. You can begin.
Well, good afternoon and welcome to everyone who is attending the 6th Annual Pathways to Hope Conference. My name is Beverly Watts-Davis, and I'm going to be your work session moderator today. So I do want you all to please share your name and the zip code that you are in, and any speaker-specific questions and comments in the Q&A, not the chat, but the Q&A box for this session. That box is going to be located on the lower section of your screen, and it does say Q&A. So again, I want to welcome everyone, and I want to get started with just a little bit of housekeeping items. Thank you all. First of all, thank you all for attending, because this is being able to share in the network across the country is always what helps makes all of us stronger. So if you're attending the conference and you want to receive continuing education units, please listen carefully. So all registered attendees who are seeking CEUs must remain in the session for the entire duration. Those sessions are going to be approximately 75 minutes long, so 1.25 continuing education units will be issued upon approval, and in the areas of licensed professional counselors, LMFTs, social workers, and psychologists. So each attendee can qualify for a total of four CEUs, eligible workshops from today, Friday, through Saturday. A post-session survey is required, so please make sure that you fill out your daily conference evaluation. For those joining us out of state, please follow our CEU instructions, but it will be your responsibility to seek final approval from your own state's credentialing board. We're grateful to have the support of NAMI Texas and Bexar County Recast Project for making these CEUs possible. Again, I want to thank everyone for being there, and for everybody who's seeking CEUs to please remember that you must remain for the entire session. So now it is my pleasure to introduce you to our speaker panel. We've got an awesome panel here today. So I'm so pleased to share with you all and tell you all about a gentleman who I have had the pleasure and honor to work with. And this is Mr. Mike Lozito. He's a director of the Judicial Services offices in Bexar County. Now, Mike has over 30 years in criminal justice experience as a pre-trial technician, a youth services officer, a parole officer, a probation officer, a section director, and a regional director. A large portion of his career was with the Texas Department of Criminal Justice. He was acknowledged by the Texas Corrections Association as the Outstanding Adult Corrections Administrator for 2008. He began his career with Bexar County in June of 2010, and we've been lucky enough to keep him since then. He is over Judicial Support Services, and he is responsible for the Pretrial Services Office and the Indigent Defense Attorney appointments. Mr. Lozito he's been the Director of Judicial Services since 2011, and he's responsible for administering the activities of all the intake and of the Justice Intake and Assessment Center, the Pretrial Services Office, the Mental Health Department, the Jail Population Impact Control Unit, the Medical Examiner's Office, the Crime Investigation Laboratory, Court Collections, Problem-Solving Court Programs, and the Dispute Resolution Center. And he has obviously no time other than to breathe. But I literally just have to tell you all just a little bit of a personal note about Mike. I've had the pleasure to work with him on the recast project for Bexar County. And we know that oftentimes many of us have thought, oh my goodness, people who work in the public sector don't necessarily get it. I have to just tell you all, we have endured such success in our program in terms of just neighborhood-based capacity building, in terms of being able to pivot on a dime to be responsive to neighborhood issues, to actually be able to do a reversal trend. We're so pleased to see the actual crime drop in our actual zip codes that we're targeting work. And to actually begin to expand to be able to be value added in terms of services that are needed throughout our community. There are often times when many of the work that we're doing, we all are saying, gosh, if we just had this, we could be able to make all the dots connect and all the dominoes would fall. Well, he has been so great in making sure that this round hole of what we're doing in terms of community change and community capacity building actually works within the square peg. Because oftentimes we're not able to do that. If it's not round and it doesn't look like this, it doesn't have exactly these dimensions, it's not accepted. But he has been our quarterback, our defender, our punter, and everything else we can make in an analogy to a successful football team to help us get over the goal line. And I just have to personally say thank you, Mike, for all the great work that you do to help make us be relevant in the community.
Thank you, Beverly. Appreciate being here.
Great. The second person who I just told her I'm so glad to see her. She looks like she's 12, and I don't know what she's using or what it is, but she's got beautiful hair and beautiful skin. So whatever it is, ladies, we'll have that conversation afterwards. But I want to introduce you to Miss Sarah Hogan, who we are so pleased to welcome here today. She's the division director at the Southwest Texas Regional Advisory Council, which we all refer to as STRAC, for the Southwest Texas Crisis Collaborative, which we all refer to as STIC. So I know when we use so many letters, it sometimes just confuses people. But I just want you to know that she came to STRAC with 8 years experience in the behavioral health field. She has a master's degree in community counseling and is a licensed professional counselor. So she gets it. She's been in the trenches. She's been on the front lines. She knows what we deal with. She has served the Bexar County community in multiple capacities. So let me just tell you about some of those. She truly was at the front line in doing case management for families of children with intellectual and developmental disabilities. Thank you so much, Sarah, for that. She has done intensive case management and counseling for the homeless and the higher utilizer populations. She's had oversight of clinical operations at the Center for Healthcare Services High Utilizer Program. She's got experience with program development, true problem solving, which we know because people develop programs to solve problems, certainly with process improvement and enhancing service delivery that results in truly improved patient outcomes. Her work at the Center for Healthcare Services really was in the area of community partnership and cross-center collaboration, which was a key component of her role. Having served the very population that the Southwest Texas Crisis Collaborative has chosen to prioritize, she believes wholeheartedly in the mission that STRAC is built on. We are so pleased to have you, Sarah, with us today. So good morning, good afternoon.
Thank you. Thanks for having me.
All right, so you all, we're going to get started in this great session. I'm excited about this session. We're going to get started with a video, and then right after that, we're going to get a chance to spend some time with both Mike and Sarah. So here's going to be a video on the whole SMART program, so that there'll be questions and things that you all can ask Mike and Sarah when we finish.
Well, on October the 6th, 2020, the Commissioners Court voted to spend some $1.5 million to create a mental health response team. So we put together a group of experts that would go out and make the calls when emergency was called in. It's a very important initiative for the city of San Antonio and Bexar County, and I'm so proud of the experts that have gone out there and helped everybody that they responded to.
So in my vehicle, it's myself, and I have my partner, Samantha. She is a licensed master's of social work. She's a social worker, and she rides with me, and we go on scene with 2 Bexar County deputies who are in plain clothes or uniforms such as mine. And we all talk to these people in phases throughout the encounter, and the end result is a de-escalation and a movement to a higher level of psychiatric care.
So we received a welfare check for a consumer of CHCS. My role is really to come in and assess the individual, evaluate their mental status, talk to them, see how they're doing, see how their day has been, see what's been going on. every person, every call is different. And so going in there and trying to make a connection, establishing rapport, and then figuring out how to best assist this individual or help them. It's very rewarding. It's very fulfilling.
We get a much better, well-rounded view of the person and whatever mental illness that they're suffering from or substance abuse issue. We get a lot better picture of that because we have different facets on the team and everyone kind of comes together and makes a consensus what the issue is and what maybe the best care for the person is. So for people in the community that might see or recognize that in their friends, family, and loved ones, that this is a resource available for them.
The follow-up again is that the case manager will go to wherever that person may have been sent to that previous night, crisis, a hospital here in the county. That case manager will meet with that person and find out if they have had any mental health diagnosis before or if they're currently under any psychotropic medications for whatever diagnosis they may have had.
When you're dealing with a person with maybe a mental health issue, you want to take time with those individuals, and our response time for those is sometimes they're for over 45 minutes talking to a person and making sure that they're okay, so the officer doesn't have to come back there again, right? That's really the routine, is to be more proactive rather than reactive in working with that particular person.
Each individual is treated as an individual. Yeah.
Very good. All right. Very good. So Mike, I'm going to start with you just for some opening comments before we really kind of get into just kind of a whole question and answer session, and then we really will take question and answer from the audience. So let me just give you and Sarah just each about a minute to really kind of give us some opening comments about SMART. And it really is, this is such a smart idea. This is so appropriately named. This is so smart to be doing in community. All right, Mike.
Thank you, and good afternoon, everybody, and thank you very much for the opportunity to talk about this program. So we're very proud of it. The program itself was, Judge Wolf and the commissioners really wanted us to figure out, if a family calls 911 and they're asking, for somebody to look after a loved one or, check on a loved one to make sure they're okay, and they may be having mental distress, the public is expecting the kind of right response, right? So, we kind of look at it as the right person for the right response, right? To make sure that when they go out there, and if you see the video, I'm very glad that we were able to have you see that, because it's very soft. When they're going out, they're all wearing, casual clothes, they're not in flak jackets and, all the armory and when they're going out there to contact somebody. And I think the other thing too that's really creative about the program and working with STRAC to have an organization like that to kind of be the backbone, and we fund the dollars to them and they work the contracts, but it was the 911 system, right? So the 911 system has always been built as a 3-button response. If there's a fire, you respond to the fire. If it's a medical issue, then they send an ambulance out. And everything else was police in that matter to address the issues. So our goal on this was to create that 4th button, and that had to be a lot of work with STRAC, working with dispatchers, the 911 dispatchers, and this is for surrounding the Bexar County area surrounding the city limits, right? So it's kind of the donut around the city of San Antonio right now, and I think the city is going to be adding on to these types of services so that donut will be filled in. But right now it's in that surrounding areas, and we want to just really make sure on that fourth button for mental health, that we're sending the right people out there and that they have that right response. And I'll let Sarah talk a little bit about what that team is and the makeup of that.
All right. Well, thanks everybody for joining. I first want to say thank you to all of our partners that have worked really hard to be able to produce such a program in such a short period of time. The program started in October of 2020. And I have to say, I've never seen a dedicated group, such a dedicated group of people coming together to achieve one goal. And that is to provide a more effective, appropriate behavioral health response to our community. As a counselor, I come from working with the Center for Healthcare Services, as Beverly mentioned earlier, and I'm thrilled to see that we are looking at mental health as a true health condition and applying the right resource to that condition from the beginning. And so, as Mike mentioned, typically when you call 911, you get police, fire, EMS response. Now we've added the fourth bucket with the mental health professional. So if you call in Bexar County right now for a 911 call and you or your family member or loved one are in a mental health crisis, there will be a series of questions that go through the dispatch protocol. And we've worked really hard to try to appropriately identify people that would benefit from this type of response. But if it's no violence, there's no concern for safety at the original call, and truly it's just a mental health crisis, you will receive 2 mental health deputies with the Bexar County Sheriff's Office at this point, a Acadian ambulance who has a paramedic that is assigned to the team, and then a qualified mental health professional with the Center for Healthcare Services would respond to that call. And really, law enforcement, Bexar County Sheriff's Office is there to secure the scene, make sure everything is safe for that team to go in and do what they need to do. And they are quickly exiting the call as soon as possible. And then really at the forefront, you're going to have the paramedic and the clinician that can take a look at everything health-wise. So your paramedic is there to provide the medical assessment, triage, making sure that there's nothing medical going on. And the clinician, the qualified mental health professional, is there to determine what is going on related to the mental health condition, help de-escalate any initial crises, and then encouraging the individual to access treatment if it's appropriate, or even connecting to ongoing outpatient care. And so what I'm thrilled about this team is that there's a tool available for each type of situation. And so, we have the right people there, and all of them add to the response to the person that is in need of help.
Very, very, very good, you all. Thank you so very much. And I want to say to our audience, many of you will have actually been putting your information in the chat. That's perfect. We want you to put your information in the chat and then put your questions and answers under Q&A. So I want to start with some of the questions that are coming in. We now have learned. So the question of what is SMART has actually been very well explained in that video. So again, I love the fact that SMART stands for Specialized Multidisciplinary Alternative. Key to that word being alternative response team, because again, for part of the issues in our field is that we have felt that unfortunately jail was beginning to be a place where people who had mental health issues were going. And so I want to say special thanks to you all, because again, this really is not just a health issue. It is also a human rights issue. And for sure as heck is a safety and just treating people right. So I want to just ask you all, is there just one SMART team currently? And if so, how many do we need? Are we there yet?
Sure, I can take that. I can take that one, Beverly. So we started initially with just one team, and that team was on Monday through Friday from 2 p.m. to 10 p.m. We have since expanded that team. Actually, in the month of August 2nd, we were able to take that to 2 teams. So now we have 2 teams on 6 a.m. to 10 p.m. Monday through Friday. And of course, we need 24/7 coverage. We are seeing the volume, particularly, and we tried to outline the teams, their shifts around the higher volume times. So we are starting to cover that. But as you can imagine, weekends and overnight are very important to be able to provide that coverage. And so I hope that we get there. We've only been running again since October. So we've had good data around why there is a need to build out further capabilities for the teams.
Good.
You know, just kind of add on to that, Beverly. Yeah, so what we found is we were working out of the downtown area and trying to respond to calls throughout Bexar County, and Bexar County is a very large county. So that's why we expanded to 2 teams, because most of the calls are on the east side and west side of Bexar County. And now we have, out of those substations on the east side and the one on the west side, we have them responding to the calls to be out there quicker. And then we did submit, we're currently in our budget year for Bexar County. And so we've submitted a request to go 24/7, which would handle weekends and all the hours for calls. So that's in the budget request. So that has been recommended to the Commissioner's Court. So I think September 14th is when the Commissioner's Court will vote on their final budget adoption, and hopefully it stays in there. But we so far received some pretty good response on it. So I'm hoping that the commissioners will approve for us to go 24/7 on there.
Well, Mike, I don't think you meant to do this, but to me, I think you've actually put on for us citizens who actually can do advocacy. I think you have actually checked off a box for us on what we actually need to make sure of, because even if it's not in the county budget, with the new ARA funds that have come in, we need to make sure that SMART gets funded. So I'm glad you let us know that's out there. So for both of you all, I heard you say the hours that you're now on for 6 a.m. to 10 p.m. Everybody's question out there is going to be, so what happens between 10:01 and 6 a.m. because the question was, is it provided 24/7? So the answer to that is no. But what happens between 10 p.m. and 6 a.m.?
So if you call 911 during those times, you will still receive a response. That response will be from a patrol officer during those hours. And so I'll just speak briefly for a minute about some of the connection to the overall system that SMART has. You could get that call. Currently, we have a navigation system in place so that people get to the right level of care from the initial crisis. And so STRAC operates a MedCom dispatch center within our offices here. And that's this program called Law Enforcement Navigation has been running for about 4 years now. And so when an individual is in a crisis and they are in police custody due to their mental health issues at the time, we are navigating those officers to the closest, most appropriate behavioral health facility. So while they do not get the response with the clinician and the medic, they should be directed to an appropriate level of care instead of an emergency department or jail.
Okay. So Mike, this one is for you. This one says, Mr. Lozito, how long does it take for the hospital to get a court order to give the patient an injection for antipsychotics because the patient refuses to take it by mouth?
That depends on the circumstances. I don't know if Sarah has a better idea on that, but any of those have to be through a court or court ordered for an individual that's not responding on there. So that could be part of the treatment plan for a doctor to recommend to a judge, and there's a hearing in front of a judge, and the judge will make a determination on that for whether it's an injection or certain medications that would help a person. But it's a lengthy process on there, and it's through the civil side and has to make sure that, that person has appropriate representation for them to make sure that, their rights are not violated through that process. I don't know, Sarah, do you have anything to add on those?
I'll just add a little bit about just to kind of level set with SMART. Obviously it's going to be from the scene. It's out in the community, and then the person may or may not have to go into treatment, to inpatient treatment. They may be able to access outpatient treatment, and the goal being least restrictive. So we're encouraging people. I mean, that's part of this team's expertise, is encouraging people to seek treatment voluntarily before it gets to the point of, an order of protective custody or an emergency detention. So I wanted to make sure we touched on that, because the goal is really to help people be educated and understand what the treatment process looks like, and then encourage them to seek help as it's needed. So that's what I would add to that question.
Now, in listening to the video and to you all, you mentioned the Center for Healthcare Services, but are there other different and the police department, certainly, but are there other different responders? And what, if so, what are their roles? You mentioned, that you have the police department. Is that the sheriff and or the city of San Antonio, or just the sheriff's officer? Who is that?
For SMART, it is just the sheriff's office at this point.
Okay.
It is a dedicated mental health unit. So it is deputies from that unit that are trained. And then with for the EMS agency, it's going to be Acadian. And Acadian responds in the county already for 911 calls. So they are also the support for this team. And then the Center for Healthcare Services offers the mental health professional.
Thank you for saying that. And Mike, I want you to know, not everybody knows that Arcadian is the EMS. They didn't. I'm glad to hear that. Mike?
Yeah, and part of the, that team response, I want you to think about it. The reason you have that emergency technician go out with you is to make sure that it's not a medical issue. I think we've had a couple calls that the person was really reacting to a medication. It wasn't a mental health issue on there where they needed to be taken to the hospital. So it could have been looked at differently, right? If it just, if a mental health person and a deputy went out to respond to the call. So, and I think the other thing that happens is we're all used to going to the doctor's office, right? We're always used to go in there, they weigh you, they take your temperature, they do your blood pressure, and those are common things, so it's not, first we're going to make sure medically that person, first is the area safe and is it secure? Then the second thing is the person medically okay in that portion of it, and that's what that emergency technician's there for. But it also bridges the gap, right? It allows that clinician to come in there, the mental health clinician, to say, okay, so how are you feeling? And so it's not just like you run on the call and all of a sudden you're addressing the mental health issues, because the person is, they're relaxing. They're, you've taken their blood pressure, you're making sure it's not a medical issue. And now the mental health person can talk to them and say, what are the issues? And I think, when you're interviewing or you're trying to elicit information from a person, that that opens the door for everybody to feel more comfortable, from the point of, hey, here's a candy bar, we have this, or did you need a soda? We have this available, on there to relax the person. To be able to get the information that you need, and for them to know that the people that are responding are there to give them help.
Good. And you guys, I've got a lot of questions coming in, so now we're going to be doing rapid fire. Okay, right. So I'm going to just skip to whichever one of you all want to jump in. So someone has said, while their clothes are casual, what safety measures do the workers in the program have in place? Mike.
So on there, number one, training, right? So everybody gets trained in the process, right? Because we're not going in just cold on the circumstances we're reviewing. So everybody knows safety techniques. We do, even before they go out on there, they do ride-alongs with the deputies. They understand what's going on, the safety precautions that are needed, and making sure that we don't let our guard down. Then I think, the other thing probably Sarah can expand on this is, so we have Kelly, right? So Kelly gets in there and she monitors things, right? So she'll listen to actual calls that come into 911. You know, could we have done this better? Can we do this better? We take surveys from individuals and families that we've been out there to see, you know, how did we handle these properly? Are they satisfied with the response that they've had? And then she actually goes out with them on calls to make sure that those safety things are being addressed with the team members. And we also, it's a pretty neat circumstance too. I think when they go out on these calls, they meet like every other week. We have meetings with the patrol supervisors and the chiefs from the different areas, the chiefs from the Acadian, the chiefs from. So there's this constant communication and evolving of the program to make sure that we're doing the right things on there. Sarah, did you have anything to add?
It's a great example of coordination and collaboration. So, all right. So Sarah, so SMART sounds like such a fantastic program for Bexar County. Now, this is someone's wish list. I hope that Comel, Guadalupe, and Travis can also be included in this program soon. Is that a possibility? Is something like that in the works? Now, I want y'all to remember that Mike and Sarah belong to Bexar County. Just putting it out there.
So no, that's a great question. What the RAC, the Regional Advisory Council, actually covers 22 counties in Southwest Texas, but all of our behavioral health focus has been in Bexar County, and really in a very strategic manner, because we're trying to get it right as we start to learn about the needs of our community. And I will say that Comel in particular is very interested. Both sheriff side and PD side and their local mental health authority have been very interested in learning from us, to the point where they, you know, we have attended multiple meetings with them to try to help share lessons learned and that kind of thing, in several programs that we support. So I think it will be coming not tomorrow, but I do know that there's a strong interest in doing that with the agencies in our surrounding counties for sure.
Very good, very good. All right, so Mike, will SMART be tied to the new 988 phone system that goes live in 2022?
I'm not sure of that. I think we're learning more. I know in the presentation this morning that was discussed on the 988 number, the national number for suicide prevention, and how those calls will be routed, you know, through local mental health authorities or through, I think it was mentioned on there, you know, we have our mobile crisis teams that are also, that go out on calls. So I guess we're kind of waiting to see, but I would envision that's probably something that would happen, you know, depending on the level of the call and what's needed on there. Sarah, your thoughts?
All right, good. Well, that's something to put on, you know, to remember in all of this as we are getting lots of response. People, you know, we're seeing San Antonio Police Department also put in responsive systems. So I'm just wanting to hope we're all going to cross our fingers that everybody between the city of San Antonio and Bexar County are responding or collaborating together, because it is they overlap so much. And this actually goes to this next call because they're asking. All right, so glad this, excuse me, they're saying, so are they answering all calls both from San Antonio and Bexar County or just Bexar County?
I'll take that one. Just Bexar County. The program supports Bexar County at this point. And I'll just comment a little bit more on Beverly about the city side of things. There has been a recommendation on the cities with the San Antonio Police Department and their resources to offer a multidisciplinary response. So that's going through the process of that recommendation. But I think both the city and the county see the need for this type of response on those sides.
And Sarah, that's really important for people to understand, because when you say, yes, it's in Bexar County, but I'm a San Antonian and I also live in Bexar County. So does that apply to me? Or if I live inside the city of San Antonio, does SMART apply to me?
Not at this time.
Okay, that's what's
Live
key.
in the county.
Okay, I see. So you have to be in the county. Got you. Only in
Right.
the county.
Let me explain to you on there, Beverly. What happens is when you call 911, depending on your location, then that's the call will go. So there's two separate kind of 911 systems. One, there's a county 911 and there's a city 911. And based on where you make your call from, that'll determine where that call goes.
Okay.
You have anything to add on that, sir? I'm not sure if I explained that well.
Okay. So as you guys can see also in the chat. So someone asked, when someone calls 911, who on the 911 line decides if it's a mental health call? Who decides that?
So there are trained dispatchers, and particularly with the county side, we have worked directly with dispatch and their leadership and all of their training department to ensure that we're identifying the appropriate calls for this team. They already had previously, before SMART, mental health training, so they were able to identify those types of calls. We've just now created a response around that and what types of calls now this team could go to in lieu of patrol only. So the dispatcher's making those calls, and like Mike mentioned, we review those calls every week. We get a list of calls that are mental health related, and if for some reason SMART was not attached to that call, and it was during their response hours, we're reviewing as to why. And so we're doing lots of performance improvement and making adjustments as we go.
So you guys, I wish we kind of had a magic wand that we could kind of have like when we decided to have a drug czar for the United States, that we have, because these questions really are about, San Antonio and Bexar County, because people, it's invisible to the population, because they're asking, does this team replace the crisis intervention team officers in SAPD or supplement them somehow? And I think there is, again, if you all could just really explain the difference, because apparently everybody wants one. Everybody wants you all to be theirs. So they're trying to figure out a way to claim you. So can Mike and Sarah, can y'all respond to that? I'm gonna let both of y'all respond to that because I can see the nature of the questions coming in.
So I'll take the first response to that. This actually just adds, it certainly does not replace the crisis intervention officers for San Antonio Police Department. And just briefly on crisis intervention training, it's now a state requirement to have 16 hours for law enforcement for that training. And SAPD actually requires that the 40-hour training to their officers. And so that is still ongoing. We are still training officers and they are responding to behavioral health calls. There is still a mental health unit with the SAPD that is doing a great job. And so it definitely does not replace that work. It just adds to another resource and hopefully a way for us to kind of learn from each other as we move forward with the city and the county approaches.
Very, very good. All right.
Beverly, to add to that, and I really think, so there have been quite a few meetings going on at the city's end and discussion regarding a study. So I think Meadows Mental Health Institute had conducted a study trying to see what would be the right fit and make recommendations. So they are strongly looking at something like the SMART system. So as public calls in, they don't get different flavors of programs on there. So, you asked, my hopes is that it would closely match the SMART program as possible on there. So we have continuity and then we work together on growing the programs, plus, figuring out the right things because, the other part on there, as you saw in the video, was the follow-up, right? And I think that's what's different from our program is that in Eugene, Oregon, they have the Cahoots program, and in Denver, Colorado, the STAR program, which we initially modeled. But one of the things, since we're working with Center for Healthcare Services, which is our local mental health authority, they have a whole array of services. And so that follow-up is the key, because not going out there to have to go out for another call, right, for the officer. Because sometimes some of those deputies are responding 2 or 3 or 4 times a week on this to the same house, and they're going, oh, okay, here's this call again on there. So, that's another level of that deputies like, or law enforcement like, is that some of these calls, which may be very difficult to handle, are now being handled by those professionals. And that frees them up to be out on the streets to handle those other emergency type calls that they need to handle. So we have so many hours of time that we've saved for patrol deputies on there. And I think when we go 24/7, hopefully, I think we're looking at responding over close to 1,500 calls a year is what our projection is. And then plus our follow-ups from Center for Healthcare Services. So they have what they call peer navigators that go out, work with them. They go take them to, like, hey, I don't have a ride to get to my medication. They'll help them.
Right.
I'm afraid to go see my doctor. I don't, my psychiatrist. They'll help and they'll follow up. Did you do what you needed to do? How can I help you do that? How can I get you the resources so that you don't fall into that crisis? So that's that proactive part that we need to be on. So it's reactive in one way, but then moving to a more proactive approach.
Mike, thank you for that, because you actually just answered one of the really important questions. And that question was, are there follow-up calls when SMART responds? But you just spoke to how the Center for, and this is coming from the Center for Healthcare Services, how they're using peer navigators to be able to follow up and to make sure that they're helping people follow through with some of the suggested things that happen during the SMART call. So that you guys, that is so very, very important, which actually brings me to a question. Again, this is a public service. And so how are the co-responders, how is the people who co-respond with you, how are they funded? So that we can, because one thing I want to make sure of, this is such a smart idea, we want to make sure it's sustained. How are they funded?
So the funding on the program is so far has been funded by the county.
Okay.
So on the video, Judge Wolf was there and he talked about that they had funded $1.5 million for us to get the program off the ground and kind of study, look at the calls and what we needed on there. And this next step on there will be funding from the county again to go 24/7, because our thing is we just wanted to make sure, and that's that all the pieces remained, right?
Yes.
That it's not like, Center for Healthcare Services, they got a grant to do this and they're going out there and then the grant goes away and then all of a sudden,
right,
there's no program. I think on the county's end, they wanted to make sure it was a whole program and that it addressed the issues. And I really, my hat's off to our commissioners and the county judge and the leadership, county manager, to really open their eyes and to see, that this is not a cheap program to run. This is a very expensive program, but it's trying to get the right person, right response. And so far, over 500 calls, no use of excessive force and no people arrested.
Wonderful.
So that at the end of the day, even if we only made one call, to me would be, the mantra on here, because I think that's what families expect when somebody's going out there to help them on one of their loved ones. And I think the other thing that they didn't think would happen, and I think we've gotten a lot of stuff on surveys, is the follow-up. They didn't expect that, because see, that's part of what I call the emergency room response. So when you go to the emergency room, the doctor in there is there to take care of that circumstance and move on right to the next patient that comes in there. So whatever it is, you broke your arm, set your arm, put the cast on, do whatever needs to be done there. Then you go see your doctor, right? Yes. And same thing for a police officer. When they're out there, they're not there to be long-term, right? They're there to address the circumstance at that time and then move on to the next call, right? That they need to do. Well, that's what when you're dealing with human beings and with treatment, medical issues. And on that end of it, it's a continuation of services, right? It's not just mending the arm or whatever, stitching somebody up. It has to be more long-term for that individual in order for them to be safe. So that's the other thing that I think really carries on this program is that, we're trying to get them connected to services. And I know STRAC has data because we keep all kinds of data on there about these cases that we're dealing with, because, in those meetings, they're always talking about scenarios. How can we improve those scenarios and those discussions at a very high level?
Mike, just listening to you, it makes me feel, I feel like going, whew. It's kind of that woosah moment, because as I was listening to this, all I'm thinking is, this is wonderful how we make sure everybody gets it. One thing that you talked about, and people should realize this on the phone, because as I'm watching some of the questions come in, that right now, this is funded by the county, and you said your primary partner, being the Center for Healthcare Services, is also funded. It's our mental health authority. So at least it feels like that there's a good chance that this will be sustained. But we as citizens still need to make sure that we let our commissioners know how important this is, so we can ensure that it's sustained. We know the Center for Healthcare Services is going to get XYZ dollars every year because they're our mental health authority. We have to hope that they will always continue to support this effort, like with their peer navigators and the follow-up, and making sure that all those things are connected, and we've connected all those dots. But at least we know that it's on the plate and we're serving it for dinner. And so we hope that we all will get a chance to take a bite out of this, and it will serve us well. So let me also ask another. So this is what someone asked. They said, why can't the city and the county work together under a single call center to send out the smart MVRTs? And then after that, I have a follow-up question to that. So you guys, this is a city county question. I want you to realize Mike and Sarah are not our elected officials. I'm not saying they shouldn't be, but I'm just simply saying that right now they're not. So I got to put that question to you guys. Why can't the city and county do that? Okay.
I think we're working toward that. I mean,
okay.
The goal is for us to have, there's uniformity in the approach of services. And I think that was brought through the Meadows when they did their report on there, that for the constituents of Bear County, because they don't know, between the city county line and all,
exactly.
all those ends of it. So it's making sure to have similar services on that end. So I think, and that's why I think we're using STRAC, and I think that's the same reason why the city is also working with STRAC on this project, is to keep that uniformity. And just like the funding, right? We're funding the deputies, we're funding the Acadian, the ambulance, the emergency technicians, the peer navigators, the clinicians. The whole thing is a one package operation that I hope continues and gets stronger.
Good. All right, you guys. All right. So Sarah, I want to be able, so this one is for you, and it is, can you please explain to everyone how SMART, PICC, and please tell everybody what that means, CCSI, please tell everybody what that means, and law enforcement, SAFD, the fire department, coordinate through STIC, STCC. So that alphabet soup, please unravel. All right, so explain how SMART, PIC, CCSI, and SAFD coordinate through STCC. Okay.
Okay, that's a very long answer. So what I'm going to do, I'm not going to get hung up on the acronyms, because that's not what you need to take away. What the takeaway would be is that STRAC is the agency that houses the Southwest Texas Crisis Collaborative, and we are a division, we're behavioral health division of STRAC. What's unique about that division is that we are the execution arm of a large steering committee with the local healthcare systems, philanthropy, the city and the county, the local mental health authority, all sitting together in a room making decisions around how to financially and strategically support behavioral health care in San Antonio. This has been going on close to 5 years now, and it's very unique to have that setting of funders in a room who are committed to improving our behavioral health system. So that overarching body, in combination with the Crisis Collaborative, which is my division, we help to execute on the vision that they have. And one of those things being, we try to make the connections between all of the different services that are offered in the community. Contracts are flowing through our organization to be able to develop common goals, metrics, transparency around data. And so with that kind of backbone structure, and then also our centralized communication center that I talked about earlier with MedCom, we're able to support kind of not just one piece of the system, but a larger vision around that. And so right now, if you are in a mental health crisis and you are not getting a specialized team responded to you in that 911 call, like I mentioned earlier, you're going through law enforcement navigation if you are going by law enforcement, and you're going to the closest mental health facility that has an open bed. We are tracking that real time in our dispatch center to make sure that you get the services that you need. All of these specialty teams have been created based on the understanding of some of that data that we've captured over the past few years. Some of that being, we've had individuals that have been frequently hospitalized and emergency detained 6 or more times in a year. So we've created something like the PIC program, which is an intensive coordination program with multiple agencies, with SAPD, the Center for Healthcare Services, and the San Antonio Fire Department, their mobile integrated healthcare team. We have a team that's dedicated to high threats and individuals that we would want to make sure that we are keeping safe, as well as individuals that are experiencing high utilization. Again, a partnership with SAPD and the Center for Healthcare Services. And now we have this kind of swing in the continuum with SMART, is that we're responding from the initial call. And so all of these multi-agency programs have been put into place to meet the need. And now it's just connecting them all together. And I know the question was, how do you get the city and the county on the same page? And I'm so glad that you said that I'm not an elected official, and I don't plan to be. So I'll speak from my counselor view of that. And I think we're headed in that direction. My hope is that we are. And by having all of these specialty teams, we've kind of learned that you need it from the beginning of the call, the 911 call, until the end, and then ongoing. You can't just stop there. And so all of these programs are interconnected in a way that probably you haven't really seen before in our community. Having the communication kind of a central point for transparency around data and really truly measuring the outcomes of each. And so I'm looking forward to it as a provider in the community, now being able to offer some of that support. So I hope that we see that happen in the months and years to come.
So I know you all, they've asked, is there a link to the video? Do you all have a link to the video that we can share with everyone that maybe we can put in the chat? Is there a link, Mike, that you all have to the video, or is it on the Bexar County website or something?
I don't know if it's on the website now, but let me see. I'll probably cut myself off on here, but yeah, we'll try and get you the link, the public link to that. I think if you go to Bexar County, to the Behavioral Health Department under the SMART initiative, you should be able to get that video. But if not, then I'll make sure it gets on there.
Okay. Oh, then that's great, because if you make sure it gets on the Bexar County site, everybody knows, at least knows where to go.
Yeah, it's very new. We had I guess about 2 weeks ago, there was a press briefing on the program to kind of, talk about us going to expansion of the, having 2 teams at the same time and expanding the hours on there. And then, now hopefully we'll be able to go 24/7 on there if we get the funding from Commissioner's Court. effective October 1st, that would be a good thing to kind of look toward that.
You know, Mike, this is for both you and Sarah, you all, this is so important. You know, I'm one of those people who, as are many people out there, everyone has applied to the county for, lots of people have applied for the ARA funds, but I'll be honest with you, I would be willing to literally support this and not take monies to know that this kind of thing is coming up. And usually I'm checking Commissioner's agenda. I just hadn't seen this on the agenda, but we really need to support this. This really is great. And our great leader, Doug Beach, actually asked this question. So Doug, I'm calling you out. He says, how can the two teams from the county, he says, how can two teams from the county and one or two teams from the city come together to possibly cover our population of 2.2 million? Bottom line, he's saying that's not enough, y'all. So how can we, you know, and I already gotten feedback on this. Mental health track 1 wants to be in live on this, and people are going, you know, so all right, so this is blowing up. So once again, you guys, this is where being a citizen. And Sarah, let me just tell you, some of the best politicians are those who never thought they wanted to be a politician. So you come from the streets, you're right on the front line, and that's always, you have a different perspective that you bring to the table. And so I'm not taking you off the table. but neither one of you. So you guys, again, there's obviously great interest to see, you know, and again, sometimes this is always just who's in charge. If people let that go, and you guys have already done this, if the city can just come together with you, follow your lead, there's a lot that can be accomplished, because it's our taxpayer dollars, period. And most people who are in San Antonio are also in their county. And I as a taxpayer have no problems in seeing that's good use of my tax dollars. And I pay a lot in taxes. So I'm very happy to see it go toward this. All right, so we also have, so this is just, they're just saying that you guys are doing an outstanding job standing this up, and it needs to be expanded, and the city of San Antonio needs to join you. So someone has asked again, how does the 988 fit into what you have in place, or does it at all? I don't know what 988 is. Could one of y'all illuminate what that is? Do either one of you know what 988 is?
Well, so this morning there was a presentation from the Assistant Secretary for SAMHSA, and so she talked a little bit about 988 and just a little bit of what I've heard on there. So there'll be just like 911, a national number that will, and that'll be basically manned 24/7 on there for, I think it's suicides is what she said on there. And so they would be, calling in to that 988 number. Right. Just what we don't know on there is somebody says on here, roll out July 22nd. I don't know if that's next year, supposedly on there. And then how does that, 2022, to connect with the services to make sure, because if somebody's in dire need, how does that information get passed on does it push over to 911 on there? There are a lot of things about phone numbers on there, because really, I think our whole goal is, at least from the county, and one of my departments is the Department of Behavioral Health that Gilbert Gonzalez is our director of. And we want to start pushing, we're spending a lot of money on the crisis end of the system. Yes. And so the studies and everything, and we've had a city county collaboration back when Dr. Bridger was there, now with Melody Woosley, city county group, and we met all the time. We were meeting like probably every 2 weeks or so to talk about mental health and where do we go. And so some of the studies that were done basically showed we need to start going upstream, and really, instead of being in this reactive mode that we're spending these dollars, is to get out there. But there's so much with Bexar County, we're one of the larger counties percentage-wise of uninsured, right? Of poverty levels, all these negatives that we have. So when you have those, that's access to insurance, and that's access to medical care, and that's access to treatment and those types of things. We have to get better at that. And I think our leadership, I know with the county commissioners, are really pushing that, on the equity basis of making sure in certain areas that we are addressing getting services out there. Right now, through University Health Systems, I know that Commissioner Justin Rodriguez helped us with $7.1 million with University Health that they dedicated to mental health. And it was expansion of a clinic on the east side that needed dire. I mean, because there were individuals that lived on the east side and they were having to go to the north side and west side for services. So we expanded the clinic over there. And then the other thing that they did was this NOW program, which I think, Sarah, you all handle, right? The NOW program is one of the programs that you fund, but that's basically been like almost like what our intent is like an urgent care for individuals that don't have money, but they're not in crisis yet. You don't have, you shouldn't have to be in crisis to get services. And that's really what we have to look at. There's no wrong door in the community. And my thought would be is eventually that, we have these, the NOW clinic right now is a pilot, but, to get these services out on the west side and the east side and the south side and strategic locations. And then, we don't have that, we reduce those crisis calls. Wouldn't that be great? One of the things that
listen, I'm offering to be a pilot site. I know Doug Beach is on this phone. He's in the session. He would love to hear it. We're both all about having a neighborhood-based pre-crisis center. Right. And so I'm there. Tell me what I need to do. But there's a whole lot of people be standing in line to help make that happen, you guys. And Mike, you're so right. We constantly wonder, we're trying to jump in and save people out of the water instead of going upstream to try to fix the bridge that they're falling through. It's just, it just makes so much sense for us to just try to see if there's something else we can do in a different way. So, by the way, the 988, someone has actually put in here, it's a mental health line instead of 911. So that's what 988 was really about. So you guys reach, one of you, Mike, you actually mentioned data, and Sarah, you mentioned data. So big question, how will the data be shared and how will the outcomes be tracked?
So part of our role within STRAC is to help organize data and put it together from multiple sources. So right now we're getting data from, each agency that participates. And what we do is take that information and put it into a meaningful story. We have data use agreements. And I'm sorry, my desk just fell. We have data use agreements in place that help support the sharing of data between the agencies. And that's kind of part of the beauty of being a part of a collaborative, is that we bring that into a room with local funders and to provide the information on how the program's doing. At the same time, we have been working, as Mike mentioned, we had a press release a few weeks ago to make sure that that information is also going out to the community. We've seen so far, I saw some questions about volume in the chat. We've seen over 500 calls since October, and that was through the end of June. And so we're seeing a climb in those calls as we started to open up the two teams. It's about 50 or so calls a month on the response side. And again, just to remind y'all, that's going to be only county responses. If we see any other teams come out of the city side, it'll be a much larger volume. But that is what we've seen so far. One of the neat things I like to highlight about that data is that about 30% of those calls are being resolved on scene, which means that the person is not having to be transported anywhere. They're provided follow-up care and options for resources in their own home. So we're able to de-escalate and intervene in a crisis that may have ended up in admission to a hospital or even jail. And so that's kind of a neat part of that. And we're seeing a growth in the voluntary calls that we're having where, again, people are willing to go get treatment once they're able to talk to a professional at the scene versus just the law enforcement response that we've seen in the past.
Mike and Sarah, I just have to tell you all, this speaks to both y'all speaking ability, but also your ability to inspire. Someone has actually said, Celeste said, this is an incredible program. It makes me wish I still worked in criminal justice and mental health. Exclamation point. And then somebody says, this has made me want to get back into the criminal justice system. I was formerly with juvenile justice. Now that mental health is starting to be taken seriously. So you guys, thanks for the recruitment, because we can certainly use more and more people with passion in this field. So you guys, I do want to ask, so this is really kind of probing. I want you to take off your hats. You both are now working in the public sector. So this is like when we peek under the cover and kind of make sure we're checking under the hood of the car to see what else needs to be done. What questions do you think the community should be asking with regard to this program? What should we as community people be asking? And in some cases, it's kind of stuff that you guys can't ask, but you know needs to be asked. Now, I'm not asking y'all to lose your jobs or anything, but I'm just asking you. But Mike, actually, what I love about Mike is going to speak truth. So yeah. Whether that be to power or to not to power, but he's going to do the right thing. So I'm putting you guys on the spot a little bit. But what should the community be asking?
I think some of the questions actually that have come through are questions that I think the community should be asking. And one of those being, if I live in a different area, I don't, how come my response looks different? And how do we encourage that conversation to continue to happen? Again, I'm talking as Sarah Hogan, the person, and just my own personal opinion. We have to be able to say, have to understand, how do we access these types of services? It's very hard for me to know that this is available in the county, but not available across our community. And so it's such a great resource. I'm super excited. I know we're early on, but the community should be asking, how do we get this response everywhere? Really.
Very, very, you are absolutely right. Okay, Mike.
I think on my end of it, I always think about it. I've always been in the kind of public safety, looking at it, through different eyes. And back, I had whole division parole officers that I used to supervise. And, I used to tell them, when you're dealing with somebody, you need to be as comfortable with the decision you made as if that person lived next door to you. And,
yes.
So it becomes personal, right? And you need to be, if you're going to be in the government public sector like we are, you have to think that way. And, so I've always thought that way, and, so be it. If somebody's not happy, well, hey, that's life. But, I think the thing that the questions that should be asked is, the equity of mental health funding, period. Should it needs to be at the level as we address healthcare. And, we're not there yet. I don't think there's any community within the United States that is, but that would be the question I would be asking is how do we get the funding for mental health, especially now that we're going through a crisis, with COVID and with the Assistant Secretary's presentation this morning, it was very clear that COVID has had an impact on mental health. Her data clearly showed the rise in calls and rise in suicides, all these things that are happening because of where we're at, but really addressing funding. Funding needs to be equal on there, just like sidewalks, just like street lights or whatever's out there. Mental health needs, and especially substance abuse on there, because that's a major area. I know it's more appropriate to address mental health issues, but substance abuse issues are really a problem for us in Bexar County. with the opioid crisis and other things that are happening, we really need to look at that and make sure that we're funding these things, because if we don't, we're paying the price down the road. And individuals that, they've always had this thing in justice involved. If a person goes to prison or this happens, it impacts 10 people in a negative way, their children,
Yes.
their employer, their wife. If a person is a positive way, 10 in a plus way.
Yes. Mike, you just made the case for what I've always been working in, and that is prevention, because truly those who are who are the most poor, who have the highest inequities, who have the highest health disparities, treatment and all the things that need to go with that oftentimes are not available. And if we could really focus in on prevention and doing health promotion and doing those kinds of things early on, addressing trauma early in people's lives, it would save us so much on the back end. It absolutely will. So you guys, so I'm going to ask one big question, and anybody in the chat or anybody else can answer. We've got literally 4 minutes, and so 2 of those I'm just going to use to wrap up. But now that we've gotten millions, hundreds of millions from both the county got that much money and the city got that much money, excuse me, there should be no reason why we cannot fund this in the way that it ought to be funded, at least this year, because that's one-time money and we're not going to get it again. So is there a reason why that can't happen?
Well, I think because the ARPA funding, and actually the ARPA funding is meant to be for 3 years in that process. So hopefully, I know on the county end, we're looking at it, and a large portion of that, the commissioners have designated so many dollars for housing and supportive housing and these different buckets for infrastructure, for behavioral health, and even in the criminal justice, I think we designated a bucket for that, to deal with those things. So I think, our political leadership, the decision makers on that, I think both from the city and county are making some good decisions and designating things in order to help take care of these social determinants that impact us all. So there is, I think there's really a push for that in this community. I don't know, Sarah, what's your final?
Yeah, no, I completely agree. I think there's no time like a good crisis to be able to capitalize on the behavioral health support needs that we've needed for a long time.
So you all, both of you have been absolutely amazing. So thank you. So I'm going to let both of you all just give us some closing comments. You have totally inspired us. I'm getting more recruits. We need to get people put in your address so we can get your names and stuff to Mike for hiring positions. And so you guys you got all these inspired folks out here. All right. So both of us, Sarah, I'm gonna let you go first, and then Mike, you can take us home. Your closing comments, Sarah.
Oh, I just want to say thank you to everybody for joining today. It was a pleasure for me to be able to talk about something that I am personally connected to. And I'm just glad that we're starting to look at mental health as a mental health condition, a health condition, and we're starting to apply the right resources to that from the very beginning. So I appreciate your time today, and I'll let Mike.
I think on, my end, it's like, just don't give up hope, don't give up on, the ideas. If you're a consumer, don't give up on that end. If you're a person that's in the field fighting those things, and don't give up, because I think it's having an impact.
So you all, we cannot thank, they have been, you guys, I'm gonna do this for you and clap for everybody, because I know if everybody could do that. You guys got 2 snaps and around the world and applause. Okay, I want to thank you guys so very much. And I want to thank all of you all for attending. You can find a recording of this session on NAMI's San Antonio YouTube channel. And if you'd like a copy of the slides, you'll find them on the Pathways for Hope website. When we close out this session, there's going to be a post-workshop survey that's going to pop up in your browser. Okay, so please, we value your thoughts and use this to give us feedback so that you can help us shape next year's conference. And also, it's required that you complete the survey if you're seeking CEUs for this workshop. So in closing, I want to just thank you all. This has been incredibly inspiring. And I just want you to know that this has made me aspire to work even harder for good things in our county. And we're just blessed to have both of you all in leadership. God put you, you're exactly where you're supposed to be at this time in your life and at this moment. So I want to thank you all so very, very much for that and for your great leadership, both of you, for your great leadership. Thank you guys so very much. Thank you. And everyone out there, thank you for attending this session. All right, bye-bye.
Thank you.